So for those of you that answered true, yes, that is correct. You do not need a single test. You don't need a BNP, you don't need a chest x-ray, you don't need an echocardiogram, you don't need an EKG. You do not need anything to diagnose congestive heart failure. The patients usually walk in saying two things, especially if you're in emergency medicine. Number one, progressively worsening shortness of breath. And number two, progressively worsening fatigue. If they say those two things, it's more likely to be CHF exacerbation rather than anything else. So what are the signs that you look for on physical exam? First thing that happens when they first start going into CHF is they will have an S3. You listen to their heart and there's an S3. It's volume overload of the heart. The vast majority of patients probably will not come in for just this. The next thing you'll see is JVP. So this is the one you guys probably want to look for. If you see JVP, then that's definitely volume overload. When they do finally come in, they're probably coming in short of breath. That's when you hear the crackles or rails in their lungs. They've got fluid in their lung. They're volume overloaded. That's what happens. Last but not least, they'll have pitting edema. If they've come in with pitting edema, it's pretty bad, and they've been in CHF for a very, very long time. So what you want to do is give them like 80 of Lasix and send them upstairs and let the internal medicine or cardiologist take care of the rest. You give it IV, obviously. Some of you brought up the point that, well, don't you need to find out how severe it is? Well, yeah. You can do an echocardiogram later to find out if it's diastolic versus systolic, how severe it is, how severe it isn't. A pretty experienced clinician could probably tell, like a cardiologist can probably tell if it's systolic or not, or diastolic. It may be hard in sometimes, but it's definitely sometimes a possibility. Now, the chest x-ray and echo and EKG and all that stuff can help support it, especially a BNP as well. You don't really need an echo at all. And a lot of times in some of these rural hospitals, you don't have it all the time. So you need to be able to diagnose it clinically, like some of the EMTs and other people in the ER doctors in here said, well, yeah, you just diagnose it. It's a clinical diagnosis. It absolutely is a clinical diagnosis. This is what we tell our medical students, our fellows, residents, other doctors that I teach when I'm at conferences. CHF is a clinical diagnosis. You do not need a single test. Person comes in with all of this. You are either clinically in CHF or clinically not in CHF, and we treat it appropriately, get you admitted, and we'll get the testing later when we actually need it. A lot of times, if they already have an EF of 15, why do you need another echogram? Because it's already bad. Anyways, I hope that helps. Pay attention for the next pop quiz. If you got it correct, shoot me your name and email address, and I'll send you something pretty sweet.